Hello ma'am, thank you so much for the opportunity. Yes, you're welcome. And before pregnancy, I was slightly on the obese side and I thought of reducing some weight. But my improper weight loss, it led to scanty periods, okay. Because of this, I was thinking of most of the time when I'll get my periods, will it become normal, led to anxiety and depression. Okay, understandable. Meanwhile, I became pregnant and blessed with a boy baby. Excellent. It's a very good news. Congratulations. And now I'm so much thinking that my child will be okay in the future, or will I face any issues like getting aspects little earlier. Okay, so the last line wasn't pretty clear, but I kind of got the gist of what you wanted to know. I presume that you were slightly on the higher weight, on the weighing a little on the higher side. Probably your BMI was high and your periods were not proper. I'm happy that you ended up with a healthy baby, and the baby is fine now. Understand one thing, per se, either prior to pregnancy or post pregnancy, the most common problem any mother, a newborn mother, would face is postpartum blues. One, probably because of the body is undergoing so many changes. The hormones which are influencing the body, like estrogen, progesterone, HCG hormones, everything, like it just wraps your body from head to toe. So it's like there are plenty of emotions going around, and sleepless because you are tired. Basically, you lose calories when you feed the baby, so you need to take extra amount of calories. By what I mean is healthy diet and get adequate sleep, because that will alleviate a lot of anxiety from you. And coming to your point, I understand that you're a little worried about your health and your baby's health. I just wanted to let you know that probably I would require more information on that. Probably like if you've had diabetes or hypertension or any thyroid issues when you are pregnant. The researches which we have, the studies which we have done, and which are available, Western data and in the Indian population, the researchers say that yes, the mothers who are slightly on the higher side or in the higher BMI when they were pregnant, or when they were complicated with diabetes, hypertension or thyroid during pregnancy, and if the baby was born slightly on the overweight side, on the weighing on the higher side, probably about 3.5 or like 4 kgs or 4.5 kgs, you have to be extremely cautious about their health, about their diet. And obviously the babies are going to walk, they're going to run. You need to really focus on the nutrition of those babies as well, because the genetic conditions such as obesity, diabetes, they do run in families, and we need to understand that nutrition plays a very important role both for yourself and for the baby. So don't worry about the weight gain post pregnancy. Because there are other couple of questions about weight loss and postpartum hair fall. I'm going to talk about postpartum in detail in my upcoming videos as well. I'll just give you a short gist of what I want you to understand. Work on it step by step. Take single step at a time. You start going on a proper meal, nutritious meal, and the exercise can start only probably by 3rd or 4th month post delivery. We usually call that phase as the puerperal phase. The puerperal phase is the phase which is post delivery, immediate post delivery. Usually we label it around 6 to 12 weeks post delivery. That's approximately 3 months. So either let it be a normal delivery or a cesarean section, your body has undergone a lot of changes and needs rest for the first 3 months. So please do not attempt any kind of exercises, irrespective of the mode of delivery you've had, until 3 months post delivery. So after 3 months, take it slowly. Don't be too harsh on yourself. Take it slowly. What I mean, start with 15 to 20 minutes of walking every day. Mild walking. Let it be a terrace or on your inside, even inside your house, doesn't really matter. The best time to walk is like during like the sunrise early morning, like say 6 to 6:30, and sunset, because that also gives a lot of immunity when you expose yourself to early morning sunrise and sunset too. And start slowly, and then probably you can increase the time limit from half an hour to 45 minutes to 1 hour. And don't be strenuous on yourself, and side by side also look upon your nutrition as well. Nutrition, what I mean, is not skipping meals. It's not about skipping meals, it's about portion control, and it's about the quantity of food and the quality of food which you have. So include a lot of vegetables, cook your vegetables, wash them regularly in this season, that's a very important thing. Boil the vegetables, have a lot of soup, vegetables, green leafy vegetables, fruits is fine. Mango is the season now. Even there are plenty of mothers who have asked me about mangoes and papayas during feeding. I would only like to say one thing. Anything in moderate quantity is fine. You don't have to avoid any kind of food unless and until you have medical risk factors like diabetes, where you need to have absolute control on your sugar levels. Otherwise, anything in moderate quantity, in small quantity is fine. And more so when you're feeding a baby, when you have mangoes, especially mangoes in this point in the season, I would like to tell you that the babies do taste the type of milk, and the babies do have flavor in your milk, and it depends on what you have for food that day. So that's extremely important as well. And you could have a little bit of spices in your milk, but then not too spicy. Don't go to the extremes, neither too bland nor too spicy. Just see how your baby is reacting after every meal of yours. That's very important. Only then you will understand that the digestion process of the baby will also evolve. And it's also very important that you try new foods. It's not that you cannot take anything new, or you cannot consume mangoes. No, definitely not that. Yes, you can take, but in little quantity, probably less quantity, and try how your baby is reacting. I don't want you to avoid much food as well.